friends, welcome to EZI Nurse, where nursing education made easy. In this session, we will dive into the most expected and most important topic of mental health nursing, which is definitely can come in the exam of PBBSc second year. Remember one thing, every respectful nurse, every great nurse was a student just like you, still facing challenges and meeting the needs. So let's conquer this topic together and make a step towards your bright, nurturing future. So let's see this topic. Define psychiatric nursing, enumerate the psychiatric nursing principle, discuss the technique of therapeutic communication. So first we will see the definition of psychiatric nursing. So it is a specialized area of nursing practice employing theories of human behavior as it is a science. So psychiatric nursing is a specialized branch or nursing practice where we can apply the theories of human behavior as it is an art, and the purposeful use of self as it is an art in the diagnosis and treatment of human responses to the actual and potential mental health problem. So we will use ourselves, we will try to give care to the patient to understand the patient problem, what is the patient behavior, and according to the behavior of the patient, we will try to give treatment as well as we will try to do the diagnosis of the patient. So this is the definition of psychiatric nursing, which is given by ANA, means American Nurse Association, in 1994. Next, we will discuss the principles of psychiatric nursing. So the principle of psychiatric nursing is very important because without that principle, we cannot work in the mental side field or mental setting field. So our first principle is patient is accepted exactly as he is. So the nurse have to accept the patient, she have to be interested in the patient, talk purposefully with the patient. Without throwing any judgment, without being judgmental about the patient, the nurse have to accept the patient exactly as he is. Next one is use self-understanding as a therapeutic tool. Means nurse first have to aware about herself. Without she is not aware about herself, about her strength, weakness, she cannot understand the patient view and patient behavior. So she must have the self-understanding as a therapeutic tool. Next one is consistency is used to contribute to the patient security. Means consistent care must be given by the nurse to the patient because it will help to build rapport, interpersonal relation between the nurse and patient will feel safe and secure in the care of nurse. So consistency must be there between the nurse-patient relationship. Next one is reassurance should be given in subtle and acceptable manner. Means nurse have to give the reassurance to the patient. Means she have to give acceptable reassurance. Means if she is saying ki everything will be fine but patient condition is worse and she is giving reassurance to the family, so which is not acceptable. The patient or family will feel that nurse is not interested in the care of the patient. So we have to give the reassurance which is subtle and in the acceptable manner. Next one is a patient behavior is changed through the emotional experiences and not by rational interpretation. Means whatever the behavior the patient is doing, and we have to change the behavior of the patient without harming the patient, without beating the patient. We have to change his behavior by emotional experiences, such as with the help of role play or dramatization, we can change the behavior of the patient. So that we have to do. Next one is an unnecessary rise in the patient anxiety should be avoided. So whatever the situation is there in the mental health ward, so we have to avoid the situation which can increase in the anxiety of the patient. So we have to avoid or we have to decrease the unnecessary rise in the patient anxiety. Next one is objective observation of the patient to understand his behavior. We have to observe the patient, how the patient is talking, how the patient is behaving, and by objective observation we have to understand the behavior of the patient. Next one is a maintain realistic nurse-patient relationship. So next principle is maintaining nurse-patient realistic relationship. So realistic nurse-patientship must be there. Social relation or personal relation should be not there. Only therapeutic relationship must be there between the nurse and patient. Next one is avoid physical and verbal forces as much as possible. So without passing any judgment, without hitting the patient, we have to teach or we have to change the behavior of the patient by emotional experiences. Next one is nursing care is the center on the patient as a person and not on the control of symptoms. So two patients can have the same symptoms, but the nursing care will be different for that patient. So we have to focus on the care, not we should not have to focus on the symptom of the patient. Next one is all explanation of the procedure and other routine are given according to the patient level of understanding. Means we have to give the explanation of the procedure and routine to the patient. Without making informed choices, we should not take decision about the patient health related aspect. So we have to make the informed choices. We have to explain each and every procedure and routine to the patient. Next one is many procedures are modified but basic principle remains unaltered. So whatever the procedures are there, most of the times they are changing, but basic principle such as the comfort, safety and confidentiality, so such as these are the simple and basic principle, so which should not get changed. So this is the principle of mental health nursing. Next we will discuss about techniques of therapeutic communication. So what is therapeutic communication? Therapeutic communication is the interaction between the nurse and the patient where the nurse will focus on the need of the patient and according to the need of the patient, the nurse will provide care to the patient. So that is a therapeutic communication. So how we will build the rapport, how we will build the interpersonal relationship with the patient. So with this technique, we can see this. So first one is active listening. Means we have to actively listen to the patient. We have to show our interest to the patient that we are listening. Means we have to maintain eye-to-eye contact. While patient is talking, we have to nod our head and at the same time we have to repeat the sentences just like I see, oh my god, this thing happened to you. Like that we have to say, and we have to say the active listening quality to the patient. Next one is a broad opening. So we can ask question to the patient such as you are looking worried today. There is something in your mind, like that we have to ask. Means patient will tell whatever the idea he is having in his mind and according to the patient problem, we can easily understand the patient feeling and according to that we can give care to the patient. Next one is a restating. Means whatever the patient is saying, we have to repeat that same thing again and again. So it will help to the patient to understand. The nurse is understanding what I am trying to say. Means if the patient is saying I was alone at that time, so you can also repeat the same sentence such as you were alone at that time. Like that we have to do the restating. Next one is a clarification. Sometimes patient say such things which we are not clear about that. Okay, so we can ask deep questions, more question about that particular topic and we can get clarity of that particular topic or that particular problem of the patient. Next one is a reflection. So whatever the patient is trying to say, we have to reflect on the patient's feeling. And next, hope and humor. So we have to give the acceptable hope and humor to the patient. We have to give hope and we have to show the sympathy to the patient. Next one is informing. So whatever we are doing, whatever the routine procedure we are doing or whatever the things we are doing in the hospital side with the patient, so we have to explain each and everything to the patient. Next one is a focusing. So there are so many problems in the patient life, but the patient will tell you some things. You can understand with that there is a particular cause of that mental illness. So you can directly focus on that topic. You can ask him to talk about that topic more, and with the help of that, you can easily provide care to the patient. Next one is sharing perception. Means what you are feeling about that patient, you can share that. Such as if the patient is not talking properly or patient is not behaving properly, so you can directly tell to the patient that your behavior is not good. Means then only patient get to know that what the other people thinking about me. So sharing perception is most important. Next one is a theme identification. So there were so many problems that patient is having, but we have to identify the actual problem because of mental illness is causing. That is called theme identification. Next one is a silence. So we have to just sit beside the patient and just just observe the patient and don't talk with the patient. Just non-verbal communication will be there between the nurse and patient. Means silently sitting with the patient also can help for the therapeutic communication, therapeutic relationship. Next one is a suggesting. So we have to provide suggestion and recommendation to the patient, but it should not be in the directive way. Patient should have the responsibility to take their own decisions. So we just have to suggest or we just have to recommend. So this is the techniques of therapeutic communication. Okay, next question is National Mental Health Program. So this question is very important. This question can definitely ask for 5 marks. Okay, so focus. So first one is the Government of India launched the National Mental Health Program in 1982, keeping the view of heavy burden of mental illness. Okay, so Government of India launched this program when in 1982, because the mental illness was increasing day by day. The patient of mental illness was increasing, and the infrastructure were not that much so that we can care that mental illness patient. Because of lack of infrastructure, the Government of India launched this program, that is a mental health program. Okay. Next one is the aim. So what is the aims of National Mental Health Program? So first one is the prevention and treatment of mental neurological disorder and their associated disabilities. So first aim is that only, that we have to prevent, we have to treat the mental illness. Next one is the use of mental health technology to improve the general health services. So whatever the therapies is there, some of the mental health technologies is there, that we have to use to improve our general life. Next one is the application of the mental health principles in the total national development to improve the quality of life. Means we will use the mental health principle, and with the help of that principle you can easily improve your life. And we have to focus on the national development. Means we have to apply this mental health principle to the national people, to the people of nation, and with the help of that we can improve our life. So this is the aims of National Mental Health Program. Next we will discuss about objectives. So first one is to ensure the availability and accessibility. Means everyone who is vulnerable or who is underprivileged, that all the people should get accessibility and availability of mental health services. Means they can get care by nurse who is working in the mental health setting. Next one is to encourage the application of mental health knowledge in the general health care and social development. Means we have to apply our mental health knowledge for general healthcare as well as for the social development. Next one is to promote the community participation. So mental health is something that we have to make aware to the people about this. Okay, so community participation is very important, and that is the third objective of National Mental Health Program. Next, there are some strategies which is developed by National Mental Health Program, and we will discuss this. First one is the integration of the mental health with primary health care through the NMHP, means National Mental Health Program. So we have to treat the mental health or mental health care as a primary health care. So this is the first strategy. Second one is provision of the tertiary care institution for the treatment of mental disorder. Means we have to provide rehabilitation services to the mental disorder patient. Third one is eradicating stigmatization. So most of the patient or most of the people feel that a mentally ill patient can harm them, can be violent in front of them. So that is a stigmatization on the other peoples. Okay. So this is the third strategy, that we have to eradicate the stigmatization of mentally ill patient, and we have to protect their right. So this is the third strategy. Next, approaches. So first one is integration of mental health care services with the existing general health care services. So we have to combine the mental health care services as a general health services. Next one is utilization of existing infrastructure of health services and delivering the minimum mental health services. So whatever the infrastructure is there which is used for the general health services, so that same infrastructure we can use for the mental health services. Next one is provision of appropriate task-oriented training to the existing health staff. So whatever the people, whatever the nurse who is working in the mental health setting, they must get the appropriate training. Next one is the linkage of mental health services with the existing community development program. So we have to link the mental health services with the community so that we can make the community aware about mental health, mental illness. Next, there are 4 components. So first one is a treatment multiple level. First one is a primary level, second is a district level, and third one is a mental hospital. So in the primary level, the mental health services must be available. So there will be multi-purpose health worker will be there, supervisor will be there, and medical officer will be there who will try to identify the cases of mental illness, and they will try to provide care to such patients. Next one is a district hospital. So there must be 30 to 35 bed for the mental illness patient must be there in the district hospital. And last one is a mental hospital. Next, rehabilitation. So the mental illness patient must get rehabilitation, tertiary care the patient should get. And third one is a prevention. So by making aware people about the mental illness, mental disorder, we can prevent so many things. So this is all about National Mental Health Program. Our next question is etiological factor contributing to mental illness. So there are many factors that can contribute to the mental illness, and we will discuss this factor one by one. So first one is a combination of biological, physiological, environmental, psychological and social factor. So mental illness can be caused by these factors. Okay. So our first factor is biological factor. So in the biological factor, first one is a hereditary. So most of the mental illness are hereditary because of the defective genes from the parents the offspring get, and because of that mental illness can cause. Next one is a biochemical factor. So there are so many neurochemicals in our brain. So if imbalance thing will happen in the brain, then that can cause the mental illness. Third one is a brain damage. So if you fall suddenly or if you get your brain injury, that can also cause mental illnesses. Next one is the physiological changes. So most of the time the female face this because the physiological changes will take place in the woman's body. Means at the time of puberty, at the time of menstruation, or in the puerperium period, delivery period. So each and every time the female is suffering by the physiological changes, and most of the time we can see the female are more prone to develop mental illnesses. Next one is a environmental factor. So whatever the environmental factor is there, such as if there is any victim who suffered from the disaster, so that can also comes under the, and that can also cause the mental illnesses, right? And if there is a faulty parenting is there, so such factors can comes under the environmental factor. Next one is a psychological factor. If you are having so much stress in your life, you are frustrated with your life, so such things can also cause mental illnesses. Next one is a social factor. Social factor are such factor which is surrounded by you, such as your like cultural pattern will be there, or anything related to your society and which is present around you, that can cause stress in your life and that can easily cause mental illnesses in your life. So that comes under the social factor. So this is the etiological factor that can contribute to the mental illnesses. Our next question is define depression, enumerate the etiological factor of depression, write the psychiatric management and nursing management of depression. So this question can be asked for 15 marks because there were 3 questions, right? So this can come for 2 marks, this can come for 5 marks, and this can also come 7 marks. Okay, so like this the question can come. So we will see the definition. So common mental disorder that present with the depressed mood, loss of interest or pleasure, feeling of guilt or low self worth, disturbed sleep or appetite, low energy and poor concentration. So depression is a common mental disorder in that the patient can have feeling of guilt or depressed mood or loss of appetite, loss of energy, low energy will be there in the patient. So this is the definition of depression. Next we will discuss the etiological factor of depression. So first one is the biological theories. So in the biological theories it is given that genetic factor can also cause the depression. Next one is a neurochemical imbalance. So neurochemicals such as a serotonin or you can say any other neurochemicals is there, and if there is an imbalance of that neurochemical will happen there, so it can lead to a depression. Next one is a genetic theories. So as I already told you, the heredity is one of the cause that can cause the mental illness, or it can also cause a depression. Next one is a behavioral theory. So whatever the stress in your life, whatever the frustration you are having in the life, and if there is any marriage problem or study related pressure you are having, so that can also lead to a depression. Next one is a sociological theories. So society, it is related to the society. Means if you are facing any problem, or if you are an introvert person, you are not able to adapt in the society, so that can also cause a depression. Sociological theory. Next one is a transaction model of stress. So stress can easily cause the depression in your life. Next one is a physical health problem. So if you are such person who is healthy and suddenly you got accident and you had a leg injury, or you found that you are not having your legs with you, so that is what? That is a physical health problem, and that can cause the mental illness, depression in the patient, right? Next one is a certain drugs and alcohol. So patient with alcohol and certain drugs can cause the depression. mental illnesses. Next one is a poor nutrition. So in your body there is not proper vitamin supplement you are taking, or you are not having that much of vitamin electrolytes in your body, so your body is not getting proper fuel to work, right? So that can also cause mental illness and depression. So this is the etiological factor of depression. Next, clinical features. So what are the symptoms we can see in the patient of depression? First one is a depressed mood. So the patient will be always in the depressed mood. They will not talk with anyone. They will like to be alone. Okay. Next one is a depressive cognition. So the patient with a depression cannot focus on anything. They will be, in the state of confused mind will be there. Next one is a suicidal thought. So if the depression get into the more severe stage, so it can cause suicidal thought and patient can lead to a suicide. Next one is a psychomotor activity. So the patient with depression having confused mind, and most of the time the psychomotor activity will be decreased in the patient of depression. Next, we will discuss the management of depression. So first one is an antidepressant, second is a physical therapies, and last one is a psychosocial therapies. So in the antidepressant, we can use selective serotonin reuptake inhibitor. So in that, citalopram, one tablet is there, so that tablet the patient can take. Next one is a tricyclic antidepressant. So tricyclic antidepressant example is imipramine. Next one is a monoamine oxidase inhibitor. Next, physical therapy is electroconvulsive therapy we can give, light therapy. So light therapy we can give to such patient who are having seasonal depression. Means we will make sure that patient is having appropriate lighting, or we will try to make such arrangement where the lighting is proper, and we will try that seating arrangement must be there and patient will sit there for 2 hours, so lighting therapy will be there. Next one is a transactional magnetic stimulation will be there. And in the psychosocial therapy, we can give psychotherapy, group therapy and family therapy to the patient of depression. So this is the management of depression. Our next question is etiology of mental subnormality, classification of mental subnormality and or mental retardation. So the definition, mental retardation or disorder is an intellectual development, means it is a disorder of intellectual development, means the offspring, the person who is suffering by the mental retardation, they will not have proper intellectual development, and because of that significant sub-average general intellectual functioning will be there in the patient. Means you can say the average general intellectual functioning, but here in the mental retardation there will be sub-average general intellectual functioning will be there in that person, resulting in the associated with the concurrent impairment in adaptive behavior and manifest during the developmental period. So during the developmental period, the person can have the intellectual disorder, the person can have a significant symptoms which can seen in the mental subnormality, mental retardation. Next we will discuss the etiology. So first one is a genetic factor. So hereditary is one of the thing that can also cause the mental retardation. Next one is a prenatal factor. So if mother is pregnant and she is not taking proper nutrient, or she is using smoke, or she is doing using alcohol, so such mother can have such baby who are having mental retardation. Next one is a perinatal factor. So if there is a obstructed delivery or the use of instrumental delivery will be there, so if the child get head injury, so at that time the mental retardation, the mental subnormality can be developed in the person. Next one is a postnatal factor. So in the postnatal factor, so many infection can cause to the person, such as encephalitis, hydrocephalus, and more than that, if the mother is not caring for that baby, so that can also lead to mental retardation. Last one is the environmental and socio-cultural factor. So this is the etiology of mental retardation. Next we will discuss the classification. So there are basically 4 types. First one is a mild, moderate, severe, profound. Okay, so in the mild, the patient will have intelligent quotient of 50 to 90%. So how the intelligent quotient is calculated, I will tell you. Okay, so intelligent quotient is calculated such as, if I am writing intelligent quotient is equal to mental age upon chronological age. Okay, so chronological age can be calculated with the help of your date of birth, but the mental age can be calculated with some intelligence tests. Okay, so there will be particular intelligence test, and that person have to fill the test, and according to the score there will be your mental age. So in this way the intelligent quotient can be calculated. Okay, so in the mild retardation, 50 to 70% of intelligent quotient the patient is having. Means that that boy or that person is educatable. Next one is a moderate. Means here the intelligent quotient will be 35 to 50% and that patient is trainable. Means we can give training to the person, training to that baby. Next one is a severe retardation. So in the severe retardation, 20 to 35% of intelligent quotient will be there and that person is dependent. Means that person or that child can be dependent on their parent for each and everything. So that is comes under the severe retardation. And last one is a profound, means life support. And here the intelligent quotient will be less than 20. So we have to provide the life support to the patient in this profound retardation. So this is the classification of mental retardation. Our next question is, make the list of psychiatric emergency and write the management of the patient with a suicidal behavior. Okay, so there are so many psychiatric emergency and the list you have to, sometime the question comes like that, you have to make the list of the emergency and you have to explain about one emergency. Okay, so like that question can come your exam. So here is some list. So first one is a attempted suicide. Means the patient sometimes get more stress and they will try to commit suicide. Next one is a violence and aggression. So anger is okay, but that anger is converting into the aggression or violence. That is not something acceptable and that comes under the psychiatric emergency. Next one is a stupor. Means the patient will be here, mutism will be there. Means patient will be silent all the time. Next one is a substance intoxication and withdrawal. So the patient who used to take alcohol or used to take cocaine, so in that violent behavior we can see and that can also comes under the psychiatric emergency. Next one is a panic attack. So because of anxiety, because of fear, or you can say because of any trouble situation, the person can get the panic attacks. Next one is a hysterical attack. In the hysterical attack, the patient can get the fits, paraplegia, hysterical paraplegia will be there in the patient or that person. Next one is a victim of disaster. So who have saw the disaster like flood, cyclone, so many things are there, right? So if there is any survival, so in that patient we can also say the patient can develop any mental disorder or mental illnesses. Next one is a rape victim. So if someone is there who have suffered by the rape, so that can also comes under the psychiatric emergencies. Next one is a serotonin syndrome. So in the serotonin syndrome we can see the patient is having bradycardia or there will be many symptoms which is not normal for that patient. So that comes under the serotonin syndrome. Next one is a drug toxicity. So if some person or if the patient has drug overuse, so at that time we can also say it is a psychiatric emergency and we have to treat the psychiatric emergency. Next we will see how to manage the suicidal behavior. Okay, so first one is be aware of certain signs which may indicate that the individual may commit suicide. So the person who wanted to commit suicide, he will show or she will show some particular sign, such as that person can close their bank account or the person can write a farewell letter. So some of the sign that patient will show to you and you have to observe as a nurse. Next one is monitor the patient safety. So we have to focus on the patient safety because most of the time the patient will think to tie herself or to cut his hand, like that they can think, right? So we have to focus on the safety of the patient. First one is do not leave the drug tray within the reach of the patient, because if we will leave the drug tray with the patient, that patient can use the drug and drug overload or drug toxicity will be happen in the patient. So we should not leave drug tray in near to the patient. Next one is a constant observation. So we have to observe constantly to the patient who is having suicidal tendency. Next one is a remove the sharp instrument. So if there is any knife or pins is there or belt is there, so we have to remove such articles. So with the help of that the patient can harm himself or herself. So such instrument we have to remove from the patient room. Next one is a never left alone. So we should not leave the patient alone, because if the patient will alone and he will think about their suicidal thoughts and which can lead to suicide. Next one is a if suicidal tendency are very severe, sedation should be given as prescribed. So we can give sedation to the patient who is having more severe suicidal thought, suicidal behavior. So this is the management of patient with a suicidal behavior. Our next question is make the list of defense mechanism and explain 3. Okay, so what is defense mechanism? So defense mechanism is something where we will try to protect ourselves by a painful thought, emotions or events. Means if there is any painful emotion or thought in your mind you are having, so you will try to protect yourself to make sure that you are safe from that feeling, and where you will use the defense mechanism. Okay, so there are list of common defense mechanism. So we will discuss this one by one. So first one is a repression. Means what we will do here, we will unconsciously suppress that feeling. Such as if there is your loved one and he is having his birthday. Okay, so if you are having fight, so you will indirectly forget about his birthday or her birthday. Like that suppression will be there. Next one is a denial. Means if one mother is there and his baby is critical and someone is telling that baby is critical, but still that mother will deny that situation, deny that fact that baby is critical. Means what we are doing, we are denying the things here. Next one is a reaction formation. So I will tell you the examples, and through the examples you will get the clear idea. Okay, so in the reaction formation, if you are having elder brother, okay, and you are jealous of your elder brother because your elder brother is so intelligent and smart, okay, but you will show the reaction, opposite reaction you will show, like you will show respect towards your brother. So that is, we will call it as a reaction formation. Next one is a rationalization. So in the rationalization we will give the acceptable reason to the society, such as if you fail in the exam, so what you will give the reason, that hostile environment was not good. So such type of rationalization we will give, and that is one kind of defense mechanism. Next one is a sublimation. And next one is a compensation, then projection, intellectualization, undoing, regression, dissociation and displacement. So this is the most common types of defense mechanism, and I have explained you the 4 types, and other types you can learn and you can see what is the different types of defense mechanism is there. Next one is a explain the mode of action in ECT, write the indicators of ECT, write the nursing care in the ECT treatment. Okay, so ECT is what? ECT is a electroconvulsive therapy. So electroconvulsive therapy is a type of somatic treatment and first introduced by Binney and Cerletti in the April 1938. So Binney and Cerletti is the first person who have discovered about the ECT. Okay, so there are 2 types of ECT. First one is a direct ECT and second one is a modified ECT. So in the direct ECT, we will directly apply the electrode on the patient head. We will not apply anesthesia or we will not give relaxant to the patient. So that is not used nowadays, but it was used previously. So that is a direct ECT. Next one is a modified ECT. So in the modified ECT, we will give anesthesia to the patient as well as relaxant to the patient, and with the help of that, we will give the ECT to the patient. So that is the modified ECT. Next we will see the application of electrode. So first one is a unilateral. So in the most dominant side, means on the right side we can apply the electrode. Next one is a bilateral. So you can apply it on the bifrontal lobe or bitemporal lobe, and last one is a bifrontal ECT. So this is the application of electrode, how you can apply the electrodes. Next one is an indicator. So on which patient you can apply the ECT. So first one is a major depression. The person who is having major depression, who is having hopelessness, helplessness, worthlessness, so in that patient we can apply ECT. Next one is a severe catatonic. So if the patient is stupor, who is not talking, or mutism is there in the patient, so the patient with a severe catatonic, in that patient we can also apply ECT. Next one is a severe psychosis and organic mental disorder. So this is the indicator of ECT. Next we will discuss about the side effect. So first one is a memory impairment, drowsiness will be there in the patient, headache will be there, and tongue bite. Why tongue bite will be there? Because during inducing ECT, if you not applied the proper tongue repressor, so that can cause a tongue injury or tongue bite to the patient. Next we will discuss about the mechanism of action. So exact mechanism is not known. Okay, so exact mechanism is not still known, but it is known that ECT is causing some changes in the hormones, neuropeptides, neurotropic factors will be there, and neurotransmitter, means there is some changes happening is there because of ECT, and that's why we are using the ECT, but the exact mechanism is not known. Next, there are a team which is help for the ECT. So first one is a psychiatrist will be there, anesthesiologist will be there, and trainers. So these 3 person is very necessary while we induce the ECT. And the most important thing is role of nurse. So while performing our role during ECT, we will see this. So first one is a pre-treatment evaluation. So in the pre-treatment evaluation, what the things we have to do? We have to check the vital sign of the patient. We have to inform the patient and family about the ECT and side effect of ECT. And the patient should be empty prior to the 6 hours before the ECT, and at the same time shampooing must be done to the hair, oil must be not there on the patient hair. So these things we have to tell and inform to the patient as well as family. And we have to withhold the medication, night medication as well as morning medication before the ECT, and before going to ECT we have to administer atropine. So these are the some things as a nurse you have to do. Next one is the intra-procedural care. So in the intra-procedural care, what we have to do? We have to provide comfortable bed to the patient. We have to promote comfort to the patient, and while doing that thing, we have to clean the electrodes. And after cleaning the electrode, we have to apply electrodes as well as we have to maintain the proper voltage, current, right? And after that, we have to clean the electrodes. And while doing this thing, we should not forget about relaxant and the anesthesia. And last one is a post-procedural care. So after doing whole procedure, what we have to assess? After the procedure, we have to assess the vital sign of the patient. We have to see if there is any side effect in the patient is there. We have to check the consciousness of the patient. So this is your responsibility as a nurse in the ECT. And our last question is lithium therapy, which can ask for 5 marks. Okay. So there lithium therapy, lithium is most commonly used mood stabilizer. Okay. So there are mainly 3 main mood stabilizer. First one is the lithium, carbamazepamine and sodium valproate. So lithium is a element with the atomic number 3 and atomic weight is 7, and it was first mood stabilizer and the first line treatment in mania. So in the mania patient who is having excessive feeling of happiness and psychomotor activity will be increased in the mania patient. So in such patient we can administer lithium. Next, the indicator. So to whom we can give the lithium? So first one is the acute mania, cyclothymia, major depressive disorder, psychoaffective disorder. In the psychoaffective disorder, schizophrenia will be there, and as well as mood disorder will be there in the schizoaffective patient. Next one is a side effect. So whatever the side effect can cause. So first one is a neurological. So neurological side effect can be caused in the patient, such as a patient can go into the coma or muscle weakness will be there in the patient. Next one is a renal. So in the renal, polydipsia and polyuria will be there in the patient. Next one is a cardiovascular. So suddenly decrease in the BP or heart block can be caused because of the lithium. Then gastrointestinal, diarrhea, vomiting, such symptoms can be there. Then in endocrine, hypothyroidism or weight gain will be seen in the patient who are taking lithium. So what are the management? What is our responsibility as a nurse if the patient is taking lithium? So first one is frequent serum lithium level evaluation. So we have to check the lithium level in the patient, because if there is a lithium toxicity, then it can cause many more symptoms or it can lead to drug toxicity in the patient. So we have to evaluate the lithium level in the patient frequently. Next one is a monitor for the side effect. So as I told you, there is so many side effect is there. So we have to assess the side effect is happening in the patient or not. And last one is ensure the dietary, sodium and fluid intake. So we have to make sure the patient is taking proper sodium intake as well as fluid intake. So this is the management of lithium therapy. So this is all about today's session. I hope you have understand. So don't forget to subscribe Easy Nurse, because Easy Nurse is making your learning very easy. So until then, bye bye and take care.